Hey everyone, and welcome back. Today we're diving into something that takes up about a third of your life, your sleeping position. Most of us never really think about how we sleep, but the position you choose can have profound effects on your physical health, mental well-being, and the quality of your rest. I'm going to walk you through every major sleeping position, explain exactly what happens to your body in each one, and help you figure out which position might be best for you. Let's start with the most popular sleeping position in the world, sleeping on your back. About 45% of adults sleep on their backs at some point during the night. When you're lying flat on your back, there are several significant benefits your body experiences. First, your spine is in a naturally neutral position. Your head, shoulders, and pelvis are all aligned along the same plane, which means there's minimal stress placed on your cervical, thoracic, and lumbar spine. This is why many chiropractors actually recommend back sleeping for people with chronic back pain. But there's more. When you sleep on your back, your internal organs aren't compressed. Your lungs have maximum expansion capacity, which means you can take deeper, fuller breaths throughout the night. This actually improves oxygen intake and can enhance your overall sleep quality. Additionally, back sleeping is excellent for your skin. You're not pressing your face against a pillow, which means fewer wrinkles, less acne, and better overall facial circulation. However, back sleeping isn't perfect. If you have sleep apnea or are prone to snoring, back sleeping can actually make these conditions worse. When you lie flat on your back, your airway can collapse more easily and gravity works against you. Your tongue and soft palate can fall backward, obstructing your breathing. So if you snore or have been diagnosed with sleep apnea, back sleeping might not be your best option. Another consideration is that sleeping on your back can increase lower back pain if you don't have proper support. If your lower back isn't supported, it can create an unnatural curve, which over time can lead to discomfort. That's why if you're a back sleeper, investing in a good pillow that supports your neck and potentially adding a pillow under your knees can make a huge difference. Now let's talk about side sleeping, which is the second most common position. About 35% of people are side sleepers, and this position has become increasingly popular among sleep experts in recent years. Side sleeping comes in two varieties, sleeping on your left side and sleeping on your right side, and these actually have different effects on your body. Let's start with left side sleeping. When you sleep on your left side, several wonderful things happen to your digestive system. Your stomach and pancreas hang naturally from the left side of your body, so sleeping on your left side actually facilitates better digestion and reduces acid reflux. Studies have shown that people who sleep on their left side experience less heartburn and fewer digestive issues. If you suffer from GERD or acid reflux, left side sleeping could genuinely change your life. Additionally, left side sleeping improves lymphatic drainage. Your lymphatic system relies partly on gravity and body position to move lymph throughout your body, and left side sleeping optimizes this process. It's also slightly better for your heart. When you sleep on your left side, you're not putting direct pressure on your heart, which is positioned slightly to the left of your body. Now, right side sleeping has its own benefits. It's slightly better for your lungs because you're not putting direct pressure on your left lung. If you have heart problems or left-sided heart issues, right side sleeping might be preferable. Right side sleeping is also beneficial if you're pregnant. It improves blood flow to your fetus and is generally recommended by obstetricians. But side sleeping in general does come with some considerations. If you sleep on your side night after night without proper support, you can develop shoulder and hip pain. The weight of your body is concentrated on these two pressure points, so having a supportive mattress is crucial. Additionally, if you sleep on your side and don't have a good pillow, it can lead to cervical spine misalignment, causing neck pain. Side sleeping can also contribute to wrinkles on the side of your face where you're pressed against the pillow, and it can even lead to one ear being positioned in a way that reduces blood flow, which can affect hearing over time. To mitigate these issues, use a pillow that keeps your neck aligned with your spine and consider a body pillow to distribute your weight more evenly. Next up is stomach sleeping. Only about 16% of the population sleeps on their stomach, and frankly, sleep experts generally don't recommend it. Let me explain why. When you're sleeping on your stomach, your head is turned to one side, which immediately creates rotation in your cervical spine. Your neck is twisted for the entire duration of your sleep, which can lead to chronic neck pain and tension headaches. But the problems don't stop there. Stomach sleeping also creates excessive rotation in your lumbar spine. Your hips rotate one direction while your chest is twisted the other way. This creates spinal stress that accumulates over time. People who sleep on their stomachs very frequently report more lower back pain and upper back tension than those in other positions. Additionally, stomach sleeping compresses your organs. Your lungs, stomach, and intestines are all being compressed by your body weight, which can actually restrict your breathing. You're also pressing your face directly into the pillow, which can contribute to acne, wrinkles, and skin irritation. There are very few benefits to stomach sleeping. The only minor advantage is that it slightly reduces snoring in some people because your airway is positioned a bit differently. But this minor benefit is vastly outweighed by the spinal stress and other issues that come with it. If you currently sleep on your stomach and can't seem to transition to another position, at least try to sleep with a very thin pillow or no pillow under your head to reduce the rotation in your cervical spine. Now, there's a position I want to talk about that's becoming increasingly recommended by sleep specialists: the fetal position. The fetal position is a variation of side sleeping where you curl your legs up and slightly curve your spine. About 40% of side sleepers actually use some variation of the fetal position. The fetal position can be wonderful for several reasons. The curved spine can actually reduce the pressure on your lower back, which is why many people with lower back pain find it comfortable. The knee bend reduces the extension in your lumbar spine, which takes stress off those nerves. It's also a very psychologically comforting position, which can help you fall asleep faster and feel more relaxed. However, if you're too curled up, if you're too tightly fetal, you can actually restrict your diaphragm, which reduces your oxygen intake and can lead to shallow breathing throughout the night. You also want to make sure you're not too tense in this position. The idea is gentle curling, not aggressive curling. And as with side sleeping, proper pillow support is essential. There's also a position I call the recovery position, which is a hybrid between back sleeping and side sleeping. You're lying on your back but with one leg bent and one arm across your body. This position combines some of the benefits of both back and side sleeping. It's excellent for spinal alignment, it keeps your airway relatively open, and it reduces pressure points. Some sleep experts consider this an underrated position. Let me also address a few other positions that people often ask me about. The zero gravity position, where your head and legs are both elevated, is actually excellent for your circulation and can reduce snoring. If you have an adjustable bed, this position is worth exploring. There's also the starfish position, which is essentially back sleeping with your arms and legs spread wide. This reduces pressure points but isn't great for spinal alignment. Now, here's the reality that's really important to understand. Most people don't sleep in one position all night. The average person changes positions between 10 and 30 times per night. This is actually healthy. You're naturally distributing the pressure on different parts of your body, which prevents issues that come from sustained pressure on one area. However, you probably have one or two preferred positions that you spend most of your time in. That's what we should focus on. And here's my recommendation for finding your best position. Consider your current health situation. Do you have back pain? Consider back sleeping or fetal positioning. Do you snore or have sleep apnea? Try side sleeping, particularly left side sleeping. Do you have acid reflux? Left side sleeping is your answer. Do you have shoulder or hip pain? Back sleeping or recovery position might be better. Consider your skin and facial aesthetics. If wrinkles concern you, back sleeping or careful side sleeping with proper pillows is best. Avoid stomach sleeping for facial health. Consider your comfort and psychology. The position that feels most natural to you is the one your body likely prefers, and forcing yourself into an unnatural position can actually disrupt your sleep quality, which defeats the purpose. But here's the important part. Regardless of which position you choose, you need proper support. This means a quality mattress that properly supports your body, pillows appropriate for your position, and potentially body pillows or additional